Well, welcome everyone. We have a lot of folks on our webinar today, and so they're still in the process of joining, so we're going to give everybody a few minutes and we'll get started kind of slowly here today. So this is the Prepared for Environmental Change webinar series. We're very happy to have you join us, and today's topic is very timely in that we're going to be discussing whether or not there's a connection, or maybe it's more accurate for me to say how there is a connection between communicable diseases such as COVID-19 and environmental changes that are happening around the globe and even right here in Indiana. So my name is Andrea Webster. I'm the implementation manager at the Environmental Resilience Institute at Indiana University. And before we get started officially, I want to let you all know that you are all muted and that we are recording today's webinar. If you have questions throughout the webinar, we encourage you to put them in the chat box and then we'll get to them at the end. But if you do have a clarifying question, if one of our presenters or one of us happens to use an acronym that we forget to explain, please type that into the chat bar and then we'll try to get that answered for you right away. If you can access that chat function by hovering your mouse over the Zoom window. So where you're seeing my video now, there should be a little option, an icon that pops up that says chat. And so you can click on that and then you can type your questions in there. We will be live tweeting today's webinar from our Twitter account, which is @prepared4change, with the 4 being the number, prepared number 4 change. And we encourage you to engage online and retweet as desired. And finally, I'm very pleased to introduce the director of the Environmental Resilience Institute, Janet McCabe, who's going to be our moderator today.
Thanks very much, Andrea, and welcome everybody to our monthly webinar. I'm particularly excited about this topic. We particularly wanted to make sure we were designing our webinar content to be mindful of the fact that we're going through a pandemic now. And so we have 2 incredibly experienced and talented people to speak to you today about different aspects of the connections and links between climate change and the conditions that create climate change and the impacts of climate change, and similarly for pandemics. I want to just take a quick minute before we get started and talk about the Institute for just a second. If you're not familiar with it, the Environmental Resilience Institute is a creation of IU's Grand Challenge, Prepared for Environmental Change. We're an institute based at IU that works across the university and with many partners outside the university to try to help Indiana become more resilient in the face of the environmental and climate changes that we are seeing in our state. One of our main focuses is local governments in Indiana and helping to provide them with data and tools and resources that will help them become more resilient. A number of the resources that we've developed and have available broadly at no charge for folks include the Hoosier Resilience Index, which is a tool for local governments to assess their own readiness for the vulnerabilities that they face with climate change. This webinar series, our toolkit called the Environmental Resilience Institute Toolkit, where you can find lots of information, sort of soup to nuts, about different environmental change issues that affect us here in Indiana. Many case studies from cities and towns around Indiana and the Midwest. It's really tailored towards the kind of communities we have here in Indiana, primarily small to mid-sized Midwestern cities. We support at the Grand Challenge and the Institute, we support environmental journalism and communication about environmental and climate issues through our podcast, In This Climate, through the Indiana Environmental Reporter, which is an online free news service, news stories produced about environmental issues that any entity in the state is free to use at no charge, as long as you attribute them to the Indiana Environmental Reporter. We have some webinars coming up that I'm also really excited about. When we talk to local communities, often what they tell us is they need help in figuring out the economic impacts of climate change, but also how to evaluate the economic pros and cons of different steps that they might take in order to become more resilient. So we'll have some experts talking about that. And then just when we might be having some extreme heat, we will have a webinar about extreme heat and how that impacts public health and infrastructure here in Indiana and things that people can do about it. Always looking for ideas for webinar topics and interesting speakers that you think would be useful. We do record these webinars and we archive all the past ones, so feel free to go to our website and see if there are topics that you are interested in. You can watch those. We have a couple of important partners and supporters in this work and want to acknowledge them. The Association of Indiana Counties and Accelerate Indiana Municipalities, who have been our partners from the very beginning, and also the Indiana Public Health Association and Health by Design, two really important organizations in Indiana that work on issues that affect local governments and the space that intersects public health, quality of life, economic vitality, and that sort of thing. We've had many people register for today's webinar. These are some examples of the groups and organizations and people that wanted to sign up. So I'm not sure where we are with attendance right now, but very pleased to see that there was a lot of interest in this. I am going to quickly introduce both of our speakers, and then I'm going to hand it over to the first one, and then he's going to hand it over to the second one. And you won't hear from me again until the end, unless there's some, big crisis, which I'm assuming there won't be. So first we'll hear from Gabe Filippelli. Gabe has recently been named Chancellor's Professor of Earth Sciences and Director of the Center for Urban Health at Indiana University, Purdue University at Indianapolis, otherwise known as IUPUI. I've known Gabe for many years, have enjoyed working with him. His work includes research and comparative analysis of past climate change impacts on terrestrial and marine ecosystems, with a particular focus on how these systems respond to rapid climate change as a way to look into how Earth and human systems will respond to current and future climate change. That sounds like something that was written in order to get him that Chancellor's Professor title. What I know about Gabe is that he is extraordinarily competent and committed to working directly with communities in Indianapolis and beyond, looking at environmental issues that affect them, like lead poisoning, like water quality, like air quality, but also just very expert on the science of climate change. And then we'll hear from Dr. Steve Jay, who I also have known for many years. Steve is Professor Emeritus at the IU School of Medicine and at the Fairbanks School of Public Health. He is past founding chair of the IU School of Medicine Department of Public Health. He teaches, does research, service in the community, and patient care. And he directed the IU School of Medicine program to establish the first Health Services Administration federally funded area health education center in Indiana. Also just extremely committed to making a difference in our community. He's an internist and a pulmonary specialist, very expert in air pollution, climate change, infectious lung diseases, that's sort of topical right now, tobacco control, health and environmental policy, and bioethics. And when I introduce Steve, I usually point out that he was the one that led the effort to have the IUPUI campus become smoke-free. So all of us breathers can thank him for that. So thanks to both of you for being with us today, and I'm going to turn it over to Gabe.
I really appreciate the opportunity to present in a very generous introduction. As I'm getting my screen up now. I'm an environmental scientist who works a lot on health issues, right? This intersection between environment and health. And so the way that we have organized this, me and Steve, is I'm going to be talking about some of the environmental factors that drive climate change and then enhance communicable disease. And then I'll pass it off. Feel free, if you have any questions, to email me, or I'm on Twitter as well. I'm not going to be live tweeting this while presenting, unfortunately, but nevertheless, I'll get on that shortly. I'm going to be talking about how a number of things, but mostly how climate change and human activities have enhanced disease transfer between organisms and human beings. So this is called zoonosis. And we're going to look at climate change and potential for future outbreaks. And I'm going to provide some highlight examples from our work here in Indiana, which describes some of the issues that we actually have in our own back door. The bottom line, though, is if it seems like things are getting worse, it's because they are in terms of climate change and pandemics. They are linked inexplicably along with our human practices, and they'll continue to do so unless we change. And these predictions have been around for a while, and unfortunately, these predictions are coming true. But fortunately, I'm going to provide toward the end the picture that we actually know how to change this. We know how to deal with climate change, and we know how to improve local and global environments as well. So we've all probably quite familiar now with COVID-19, which is the disease that's manifested from the SARS-CoV-2 virus. That's just a cousin of the SARS virus that hit almost 2 decades ago. And it is a coronavirus, which is an extremely common virus we have around. This one, for reasons that I'm sure Stephen will get into a little bit more in depth, this one is just particularly infectious. But we're familiar with all of these communicable diseases, and they all have sort of different flavors to them and different vectors. So that ranges from Giardia, which of course is a waterborne disease, from bacterium, to hantavirus, which has a rat intermediary, to Lyme disease, and so forth with ticks. And these diseases have been around since dinosaurs have been around, to tell you the truth. I'm reading a great book on the mosquito, and it describes how the dinosaurs were attacked by some of these diseases as well through mosquitoes. So they've been around for quite a while. Like I said, most of them have a middle partner in this exchange, and so some of those are what we consider natural partners. Certainly, we've had bats, mosquitoes, and pangolins for quite a long time, so they've always been present in our environment. Yes, we've had pigs, chickens, and mice for that long as well, but we've been, in particular with pigs and chickens, we certainly have been domesticating them quite a bit. And it ends up that a lot of this domestication of these livestock are what's putting us in very close proximity to these vectors. Now, a lot of these organisms are not sickened by what they're carrying. Certainly mosquito is not sickened at all to be carrying Zika, nor is a bat sickened by breeding the virus that's this coronavirus. But it takes a couple steps in this process to end up getting infected. So why is it that we've seen a sharp increase over the past 100 years? And it's largely for 2 factors: climate change and what I call the knock-on effects of what we're doing, which are causing climate change, as well as human practices. So the human practices include how we're rearing livestock, how we're trading livestock, our encroachment on wildlands, and the speed of travel, which allows an epidemic to become a pandemic. As I mentioned early on, I'm going to focus mainly on climate change and related activities and turn the health stuff over to actually the health expert in the second half. These environmental pressures all sort of come down to factors related to climate change. Climate change does one thing, and that's how we measure climate change, is it alters the distribution of temperature and precipitation. And a lot of our work with the Environmental Resilience Institute is actually looking at those changes and beginning to forecast them into the future. We already have ample evidence that they've occurred in the past, and they're continuing to occur to this present day. But the ramifications of both of this alteration of temperature and precipitation is it changes ecosystems. It causes some ecosystems to collapse entirely. We are seeing that play out in large deaths on coral reefs, but there's other ecosystems, terrestrial ecosystems, which this occurs on as well. But it also causes ecosystems to migrate, as well as the species that are a part of them. And this is it's this migration, and I'll bring this up in a local example. It's this migration of tropical vectors to what were in the past temperate environments like Indiana and others that are causing are one of the main factors as well in disease spread. So it generally expands the range of vectors. There's of course also deforestation, which contributes directly to climate change through carbon emissions directly from burning, as well as from soil loss. And there's biodiversity loss and environmental degradation, which is again a culmination of climate change impacts as well as what we're doing to the environment. In a nutshell, they all move what were previously endemic wild species into very close contact with humans. We saw how this played out with the Ebola virus in Western Africa, where deforestation and movement of populations ended up butting up directly against mosquito-borne pathogens, and then our own practices of how we dealt with, monkey-borne pathogens, and then our own practices of how we handled bushmeat then caused the problem to accelerate. And in a nutshell, these environmental pressures is best, I think, captured in this fantastic quote: rampant deforestation, uncontrolled expansion of agriculture, and so forth, have created this perfect storm for the spillover disease from wildlife to people. And this was published by our very own IU's Environmental Resilience Institute's very own Eduardo Brandizio just last week. And I think it encapsulates these issues very well. And I like to think that in a sense, all roads lead to climate change. I know that's overgeneralizing, but let's take a couple examples of this. For example, we've all heard of rampant wildfires that occurred in Australia. Well, there's wildfires that are occurring in a lot of places. Some of them are human triggered. A lot of it is because of changes in rainfall and temperature. And so these wildfires cause the movement of the species that were endemic to those forests toward human habitations, right? So in this case, there's a bat that's now fled that forest and now is living on a farm or near a farm that's raising pigs, and the pigs get infected and pass it on to the farmer. Similarly, climate change can lead to extreme flooding. We've seen this in Southeast Asia quite a bit, and even in our own state. And the flooding, of course, is a perfect breeding ground for mosquitoes. And those mosquitoes can bear these pathogens and transfer them into chickens, for example. So this is the chicken example, and then into people. And finally, there's deforestation and human practices. So deforestation again causes destruction of landscape, which makes wild organisms come into contact with us. In this case, it's via pangolin, which is then sold and butchered in a wet market in China. So if we want to think of these communicable diseases, they are not just born in China, born in Africa, or wherever. Actually, many of them are born here in the US or Europe. There's many examples of that. And so this is a global phenomenon. And of course, it's made worse by the fact that we are a global society now, and we travel pretty freely and rapidly. And so it's difficult to get ahead of some of these epidemics. I just want to leave it out on the table right now. There's absolutely no evidence that this virus leaked out of a Chinese research lab. That doesn't mean it didn't, but there's no evidence whatsoever. On the other hand, there's lots of evidence that it is just a run-of-the-mill, but particularly fierce virus that follows the same pattern as SARS, Ebola, MERS, hantavirus, and so forth. It basically came from the wild and into humans. So why do I say that these problems will continue to be with us? Well, it's because climate change is going to continue to be with us. Climate change is driven largely by the emissions of carbon from our practices in the atmosphere, where it acts as a greenhouse gas and changes the distribution of temperature and precipitation. This is a measurement from Mauna Loa, which is just our longest running observation station. They all look, basically all the carbon records look the same. They've gone up, and in fact, their increase is slightly exponential or is greater than linear. For example, my first breath, I gave myself a favor. I marked myself at 1967. Okay, I'll stick with 67. That's a fine year. I was actually in 1964. My first breath was 320 parts per million carbon dioxide. My son's first breath was already up to about 365. And my daughter's first breath was already up to about 382. So from generation to generation, it went up by 35 parts per million. And even within one single generation, my oldest son to my youngest daughter, it went up substantially. And you can see it continues to the present. We know what drives this. What drives this is carbon emissions. And we know what would stop this, this trend from being exponential, which is stopping emitting carbon. So it's a pretty straightforward recipe, really. We have seen that it's linked very strongly to global temperatures. There's certain variations in temperatures. Sometimes ocean stores extra heat, sometimes it stores less, but regardless, it's no surprise that the hottest 5 years on record have been the last 5 years. This is a trend that we've seen globally. What that effectively does is it moves us to a different latitude. So it moves us toward a more tropical latitude effectively. So when I was mentioning that these vector-borne diseases these tropical ones are moving to temperate zones, it's probably more accurate to say that temperate zones are moving to the tropics. And this is the projection that we have for this coming century under a couple different scenarios. So you can see that we've already experienced the weather is different here, and it will continue to be so. One of the ramifications of this is this combination of warmer winters and more flooding. Warmer winters means that you don't kill off larvae, insect larvae, especially the viral larvae of mosquitoes and ticks, or you simply don't kill as many as you usually do. And more flooding is, of course, perfect breeding ground for mosquitoes. And so that combination allows the expansion of vector-borne diseases. We could see that right here in our data from Indianapolis, where the number of mosquitoes caught in mosquito traps by the Marion County Public Health Department increased fourfold in this time frame, was 400%. And that's again likely related to a lot more flooding, particularly spring flooding that we've had. Similarly, Lyme disease has expanded tremendously. Now, the incidence of Lyme disease doesn't always mean that there aren't cases that go undiagnosed. This is just diagnosed Lyme disease, but the expansion of species that bear the Lyme disease, so deer tick and other deer, is likely to be the main driver, along with climate change, of this trend from 1996 until 2014, this huge explosion in Lyme disease cases, again by about 400%. And so these are both evidence that doesn't even require advanced modeling. It's actually just evidence that the environment's changed substantially. And it's these kinds of changes that have that can help contribute to the current pandemic as well as future ones. We are not powerless in this quest to try to slow the speed of climate change and pandemic spread and pandemic growth. I had used the carbon dioxide record or the greenhouse gas record in a couple slides ago, but you could see that there's a number of trajectories that we could head toward depending on how much we control our own future emissions. And it could be a trajectory that's more manageable, like the blue trajectory on the bottom, or one that's less manageable, like the violet one. Regardless, the future truly is in our hands. And I want you to leave with a couple kind of take homes that I've worked on quite a bit. You might have heard that carbon emissions have dropped tremendously. They're going to drop 8% this year from COVID-19. We need them to drop about 7% a year to meet the Paris Climate Agreement targets. Nevertheless, it's dropped 8% in this year. But that drop is from collapsing the entire global transport systems and collapsing economic engines around the globe. So it's not putting up a solar panel or riding your bike to work one day a week, that's great. Do all that stuff, but it's not going to solve this problem. What I'm thinking might be a motivator is the fact that cities around the world are now able to see the mountains behind them. My colleagues, I was on a webinar last week, colleagues in Pakistan, they can see the Himalayas for the first time ever. And so that smog is largely from vehicle emissions and the reduction of vehicle emissions because of shutdown. I'm hoping that that clean air might be one of the global inspirations to actually change practices and expand our ability to de-electrify or I guess decarbonize all of our electrical systems and transport systems. Before I pass it on to Steve, I'll just leave you with this. You would think that the public health response would be a well-oiled machine by now, but yet again, have been blindsided. This is by a book to the Stockholm paradigm. All of these are links once this is online. You'd think that that was published last week, but no, that was a book that was published in 2019. So I don't know what Brooks, Hoberg, and Boger would say about the situation now, but clearly we've been blindsided again in a serious way. So I'm going to now pass it over to Steve, and I'm going to be hanging on and happy to answer questions at the very end.
Can everybody see that?
We're not seeing your screen, Steve.
Oh, how about now?
Nope.
All right. Would you like for me to share that for you, Steve? Oh, looks like you figured it out.
There we go. There we go.
Sorry about that.
No problem.
Thank you very much for the privilege of interacting with two of my favorite people, Janet and Gabe Filippelli, and the Environmental Resilience Institute at IU, which is really a great step forward. Well, let me start by just emphasizing the link that Dr. Filippelli has already mentioned, but here's my list of a few of the sort of existential threats, if you will, that I see in addition to COVID and climate change, air pollution, loss of biodiversity, and another one you don't hear a lot about, but it's critically important, antimicrobial resistant infections. The good news is these are amenable to science-based public health mitigation and adaptation strategies, but our challenge today is the foundations of public health, the science, the rule of law and human rights and civil discourse are in troubled times, undermined at this pivotal time when climate change and pandemics threaten societies and global health and wealth. The evidence for the links between environmental change and communicable disease is robust. As Dr. Filippelli suggested, the attributable fraction of diseases caused by environmental factors can be measured and is very useful to inform public health interventions. At a local level in communities around the world, decreased quality of water, food, sanitation, increased rates of communicable diarrheal diseases as a result, air pollution, of course, and climate change increase infectious diseases, including COVID pneumonia. The catastrophic deforestation was mentioned by Dr. Filippelli, and this is just one of many, many research papers that demonstrate how deforestation creates hotspots, in this case for malaria and dengue, from spread of the Anopheles and Aedes mosquitoes. Now, all of this, these links should not be surprising. We have to go back to Hippocrates, and I'm sure it was before him. But anyway, in Airs, Waters, and Places, a famous treatise, he described the links between the human condition and environmental changes in beautiful terms, evidenced nowadays and today by the COVID-19 passing through bats and civets and to humans, frightening yet long predicted by philosophers and scientists. In essence, environmental degradation is a bridge for nasty viruses to pass from the wild niches to civilization. The potential environmental and public health effects of climate change were predicted long ago, but in the 50s, a chap by the name of Keeling had measured atmospheric CO2 at Mauna Loa. Somebody has to do that as a grad student. Mauna Loa is not a bad place. But he measured increase in CO2 in parts per million, 316 in 1958 to, it's about 416 today. But scientists in the 50s were predicting radical effects on climate and health by 2000. The power of science, I guess, to predict. They pretty much hit things on target at that time. Today, and I might add another mention that as a pulmonary fellow in Dallas back in 1970, we were measuring gases in the atmosphere and in patients and so on. And we actually knew of Keeling's work and discussed the possibility of changing our patient standards to account for the small but measurable increases in CO2 at that time. So we've known a long time about these problems. Well, today, as global CO2 and temperature increase, weather is, as we know, unpredictable, sea levels rise, and we face unprecedented harms that are sort of described in this cartoon. And if you go clockwise, we see these are real threats and actual diseases and suffering that occur today as we speak, all around the world. So this is not in the future, this is now. These are some of the problems. Air pollution with asthma, COPD, even cause of lung cancer, vector-borne infections, Lyme disease, malaria and dengue, respiratory allergies, waterborne cholera and leptospirosis, environmental refugees with forced migration and civil conflict, and a myriad of communicable diseases. Mental anguish, anxiety, despair, PTSD, a significant problem today. Degraded water and food with starvation and diarrhea, heat stress and heart failure. And finally, injuries and fatalities from severe weather. The little child with his teddy bear at his feet sits in his home rubble, a victim of Katrina. The good news, after all that bad news, is that since 1970-72, the Clean Air and Water Acts and more recent rules, air pollution, water quality, and Americans' health have significantly improved. Unfortunately, Harvard and Columbia law schools just reported a pretty remarkable dismantling of nearly 100 environmental rules in the past 3 years, primarily at EPA, where rollback of about 27 of those rules will increase Americans' risk of morbidity, mortality from respiratory disease. Ironic and tragic, since COVID-19 patients commonly present and die from a respiratory disease, pneumonia. The net sum of climate change attributable diseases globally is very difficult to estimate, but the rough estimates have millions of diseases, many deaths being caused around the world, with cost to the world economy estimated to be $8 trillion by 2050. And there's a troubling global mismatch between countries' greenhouse gas emissions and their burden of harms. Wealthy countries pollute, poor countries suffer, a global equity and justice challenge for humanity to address. As sea levels rise, climate refugees appear. around the world, including the US, Native Americans at the Ile de Jean Charles in the Mississippi Delta, and at Kivalina, Alaska. I believe Janet McCabe visited there at one time. Climate refugees suffer a myriad of communicable diseases and are projected to be 5 to 10% of the global population by 2050, about 200 million people. A great challenge for public health and humanitarian organizations. These environmental changes increase the risks of communicable diseases, whether epidemics or pandemics. And we talk today of things going viral. Indeed, viruses may explode in a non-immune population, as shown here. One case, January 8th, 500, January 23rd, 3.1 million, April 28th. America, unfortunately, leads the world in COVID-19 morbidity and mortality. This exponential growth is preventable. Public health aim is to decrease contagiousness, the number of cases caused on average by an infected person, so-called basic reproduction number. The R number, which is very useful for COVID-19 today, is about 2 to 4, although that needs more research, but it's in that range. Seasoned veterans of epidemics know that to achieve and sustain an R of less than 1 requires first being prepared, testing, isolation, contact tracing, acting decisively using science-based measures. Interestingly, Albert Bartlett, a famous lecturer in 1969, a physicist by trade, said, quote, "The greatest shortcoming of the human race is our inability to understand the exponential function," end quote. One wonders whether resistance to swift action in the US regarding climate change and COVID-19 stems in part from this inability. COVID-19 models forecast cumulative death, and estimates vary with assumptions. Most models are inaccurate. Some of them are very useful. That's a quote from somebody else, and I think captures the problems of estimating things into the future with so many unknown variables. The difference shown here in this slide between strong contact reduction and weak contact reductions, about 50,000 deaths in the coming weeks, depending on our action to slow the spread. These models are estimating direct morbidity and mortality of COVID-19. Less is known about indirect impacts of COVID-19, but they're likely substantial and include things like loss of routine care, lack of medicines and technology, infection and death of frontline workers, persons not treated when hospitals are overwhelmed, decrease in public health services during this time, quarantine-related stress, domestic violence, and suicide, today a particular concern, loss of jobs, health insurance. Direct and indirect morbidity of COVID-19 disproportionately affects the poor, the racial and ethnic minorities, the disabled and uninsured. And I think these pandemics and climate change are unmasking terrible concerns that we have for, as some people call, the least among us. In this 5th month of the pandemic, the relative effectiveness of responses among countries has become apparent. The US response, compared to other countries, has been slow, confused, and driven more by policy than science, unfortunately. But 2 states deserve some credit. There are others, but I'll pick on 2, California and Washington. They were prepared, organized, prompt in statewide science-based decisions. Washington's COVID-19 death rate of 12 per 100,000 population and California's 7 per 100,000 reflects some wise decision-making. New York lost some critical time early, just a couple of weeks, but it makes all the difference with exponential change. But they lost a couple of weeks before showing excellence actually in catching up. But their death rate is 135 over 100,000 population. Both Washington and California are cautiously reopening business based on data-driven process. Keeping an R less than 1 isn't easy. Many states are reopening now without such rigorous data, and we will see outbreaks. With no vaccine or safe, effective drugs, we have to use traditional means, which are effective. The CDC guidelines in this case, hand washing, avoid touching the face, 6 feet physical distance, wearing masks, avoiding close contact with the sick, staying at home, cleaning surfaces, covering nose and mouth for sneeze and cough. At a community or state level, key are surveillance, testing, isolation, compulsive contact tracing, really keys to minimizing surges and return of business shutdowns, which are being experienced now in many parts of the world. National leadership to coordinate America's response to COVID-19 is needed. Many countries have excelled in their responses. I picked just a few here: South Korea, Germany, New Zealand, Taiwan, among others. They share characteristics. They were well prepared, based in part on their experience with SARS. They were organized, decisive, early targeted high per capita testing. They had excellent technology and data analytics support, and their national leaders were science-based, transparent, empathetic. They used general measures based on data to fit their needs, social distancing, masks, and so on. And a key I want to stress is national health insurance, which we do not have in the United States, but it has been a critical factor, a critical piece in the success of countries in dealing with this pandemic. COVID-19 reproduction rates among US states are shown here in the upper panel from April, and it just shows R numbers at 1 or greater in red. That's not good. The goal is R values consistently less than 1. In the bottom panel, Germany's aggressive control effort decreased their R numbers from about 4 to less than 1 from January 28th to March 24th. Quality R number data are invaluable in planning reopening of businesses. Without such data frequently repeated and reported, decisions for opening will likely fail. A prominent public health expert at Hopkins Bloomberg School of Public Health recently urged the CDC to report and communicate transparently the R number data to the public to increase public buy-in and understanding of the actions being taken to slow the spread of COVID-19. Just a brief word on Indiana. We rank 14th in the US with about 25,000 cases, 1,500 deaths. Indiana, unfortunately, lacks public health infrastructure, ranking 47th out of 50 states for state and federal funding for public health. And as with most other states, Indiana has a disproportionate representation of racial ethnic minorities among COVID-19 cases and deaths. But overall, ISDH, local health departments, our universities and community hospitals are providing excellent care for patients and their family. In summary, climate change and COVID, along with other global public health threats I mentioned earlier, have laid bare humanity's challenges. The issue may appear overwhelming, but with thoughtful science-based nonpartisan leadership, we will prevail. 1944, a B-24 Liberator plane rolled off the assembly line every hour for months at a time. Americans have risen to existential challenges. The good news is that science has informed our way forward. I've listed a few near-term actions, sort of my biases, to consider. First, reestablishing the Office of Pandemic Preparedness, which was discontinued in 2018. Commit to the Paris Agreement and aggressively pursue decarbonizing our economy and the global economy. Create science-based, transparent, credible public communications, so important during crises such as ours. Establish national health insurance, as I mentioned. restore major funding cuts, which we've suffered over the last many years, actually, at CDC, NIH, NSF, our universities, R&D, and public health infrastructure, a topic of great concern to the National Academies of Science. Create international collaboration and partnerships for tracking U.S. global impacts of public health emergencies. We have to work internationally with our colleagues around the world, and establish a just transition for workers adversely and disproportionately impacted by climate change and pandemics. And just an added note, try to, as soon as possible, return to a bipartisan Congress. The good news is we have a start on decarbonizing the environment. These data are from the World Bank, and they list 57 major pricing initiatives in the world, implemented or scheduled. We just need to fill the color on this map quickly. COVID-19 has reminded all of us to take care of ourselves, our families and friends, and support those in harm's way. The celebrations of our frontline heroes are moving and really capture the bright side of America, humanity. And finally, I think there's some great news, maybe even increasing exponentially, the number of voices for change that we're hearing in this country and around the world. Evidence-based advocacy is energizing youth, Greta Thunberg and others. This is a once and a chance lifetime to transform our thinking and actions, hopefully bold, innovative, and restorative.
Thank you, Steve. That was great, both of you. Thank you so much. We have a little bit of time for questions. So thanks to those of you that have been putting questions in the chat box, and Gabe has been responding to some of them. One question, Steve, for you is, what are your thoughts on COVID-19 immunity after exposure? That's much in the news right now.
It is, and I'm not an expert in that area, but we need a lot more research. It's based on studies with other viruses. You're exposed and you'll get an increase in IgM and then later IgG antibodies, and that protect you from future events. That has to be demonstrated, however, for this virus, and it hasn't been as yet. So we're still a little bit uncertain. There's nothing that I know of that would prevent that from happening, but we just need more data. There are some people donating plasma with antibodies, as we probably have read about, which I think is definitely worth trying. And there are anecdotal cases to suggest that has done some people some good. But again, much more research is needed.
Great. I wanted to ask both of you if you could comment on the couple of studies that have been reported on recently that show a correlation, at least, between high rates of COVID-19 and mortality, perhaps, and areas of excess air pollution.
Gabe, you want to start?
I'll start, and then of course let the pulmonologist actually weigh in. I know the air pollution part pretty well, and I've been reading about this quite a bit because we've done our own work on the impact of COVID shutdown on air quality here in Indianapolis. We have seen about a 30 to 40% improvement in air quality this year compared to last, again, because of the near total shutdown of the entire system. But nevertheless, it kind of shows a tight connection between our actions in a local environmental issue as well as then the global issue of climate change. When I've seen those connections being made, which is that if you've been exposed to poor air for a long time, you are more susceptible to the more severe side of COVID-19. Unfortunately, so I've seen that, and it's borne out a little bit in some evidence from Italy, for example. But doesn't, there's way too many confounding factors here. For example, the people exposed to poor air in this country are typically also the ones of lower economic and health status. So whether that's because they've been exposed to bad air, or whether it's simply because they're poor, they don't have access to proper health care, and they're not doing preventative work, this could all tie into it. But I guess that the bottom line is that there doesn't be a tight enough connection yet because of those issues.
Yeah, what we have are a lot of data that go back for viral infections in general, viral pneumonias, for example, and studies that show pretty regularly that viruses go to the lungs and upset the ecosystem within the lungs and create lots of havoc, from pneumonia to pulmonary edema, what we call interstitial lung disease, which is just a thickening of the lung. And so those data are pretty clear. Now, factoring out the variables that Dr. Filippelli mentioned has been a tremendous challenge, but it has been done to the satisfaction of most now, so that if you tease out all those variables that you've got to factor in, smoking and socioeconomic status, et cetera, it looks pretty clearly that air pollution per se, particularly fine particles, but also oxides of nitrogen and sulfur, cause increase in susceptibility. They change your immune status, the immunity of the lung and your immune status, to make you more susceptible to respiratory infections. I think the example that Gabe mentioned earlier, of how the fact you can see the mountains clearly for the first time in the lifespan is so critically important in getting people's attention. And the fact that short-term air pollution, as Dr. Filippelli mentioned, has dropped dramatically in places like China and in the United States. And maybe these are the kinds of sort of symbolic things that will get people thinking about not returning after the COVID pandemic to business as usual and repolluting things. Some of the experts have weighed in and said it's not going to take long, if that happens, before we're right back to where we started.
Thanks, both of you. One of the questions that came through the chat box had to do with how we balance our emphasis on mitigation versus adaptation. And we deal with that a lot at the Environmental Resilience Institute. So I wonder if either or both of you could speak to that.
I posted a brief reply to Christy, but yeah, we're too far past the point where we're not going to have to adapt. So mitigation and adaptation are going to have to be going on together. I think the key here is that the more emphasis you put on mitigation and rapid mitigation, the less chaotic and deadly will be the adaptive response we will need to this.
Yeah, I would agree. I'm not a fan of dichotomies or even trichotomies. To say mitigation and adaptation, what about prevention? Let's prevent it. You actually have to do all these things together. It's a system. And so I would agree with Dr. Filippelli's comments. We're way past the time when we could lean just on one factor, but we need to consider and continue to keep in our forefront the efforts to prevent climate change, to prevent these viral diseases. And we're now at the point where obviously adaptation is crucial, with a lot of good work going on around the world and in the United States in that regard. I think California was the first state to develop a statewide adaptation plan, or at least one of the first states, which was a long time ago. So we've had some head start in trying to understand exactly what that means. Of course, it differs where you are in the country. dramatically, actually, in terms of how you organize things and structure things to best adapt to that.
But I would just add that we use the word resilience a lot at the Environmental Resilience Institute because it's right there in our name. And I've been thinking a lot about how to explain that to people, what really is resilience. Because I think some people come to it with the notion that resilience is being able to bounce back when something bad has happened to you. And to me, that conveys two incorrect premises. One is that we want to just get back to wherever we were before, as opposed to getting to a better state in the future. And the other is that you're just sort of waiting around for the bad thing to happen so that you have this opportunity to bounce. And when I talk about resilience, I really explain it as having 3 steps. The first of which is to reduce the likelihood that the bad thing will happen to begin with. And that's, if you're worried about your biggest employer in town leaving, you don't just sit around and wait for them to leave. You work with them to make sure they're happy and want to stay. So mitigation is step 1, but you don't have to call it that if that is problematic for people. And the second step is to make choices now that won't increase your risk of harm in the future, which means being informed about where the floodplains are going to be and where the high heat hotspots are going to be, and make decisions now to keep people, fewer people from being at risk there, and property and that sort of thing. And then step 3 is prepare for the unavoidable, which certainly that we need to do. So I didn't mean to hog the floor there. Andrea, you usually run these questions, and I've just completely hogged it. So why don't I turn it back to you to do this in the way that you know how to do so well?
Well, I mean, I think we're fine to continue on as is. I'm scrolling down to see what questions we haven't gotten to yet, but if anybody has a question they'd like to offer up verbally, feel free to do so.
I'd be happy to receive emails myself. I'm not much into the other social media stuff. I do text, but send me an email if I can provide literature, data, or what have you.
Yeah, I mean, several people have commented here that we're just running out of time, and these solutions are so huge and it's so hard. How do we keep it moving? Julia chatted, I hope for transformational behavior from humans around the world as a result of COVID-19. Me too, me too. And if people on this webinar are interested or have ideas, I would encourage you to send email to Andrea or me, or directly to Gabe or Steve, but we can kind of collate it. And especially if people have ideas about how we can have these conversations here in Indiana, I do think that we have an incredible opportunity here, unasked for, with much suffering by many people. But if we don't learn lessons from this experience, then shame on us. However people come to this, whatever moves them, let's use that approach with those different folks.
So one question that has come in, and maybe we'll leave this as the last question. So if we were to become carbon neutral, what effect would methane emissions, let's see. What effect would the methane emissions have on us that we can't control?
I was just asked about an hour ago by my neighbor whether he should go vegetarian. I kid you not. And he had read something about methane and meat production and so on. So we had a brief chat. And as you probably know, there would be a big difference if everybody in the world went vegetarian. Don't quote me to say that everybody should do that. But production of meat does lots of sort of bad things to the air, the environment. Methane's about 35 times more potent a greenhouse gas than CO2, so it's a big issue.
And of course, there are dependence on natural gas, and the exploitation of natural gas makes that a little bit worse. Natural gas is methane, and we found that it's significantly leaking from production fields even before it's turning on your stove or your furnace. So and we've been actually looking at these methane sniffers. So there's ways to actually see methane from outer space pretty clearly. And we've just had a new result out last week, just shows the immense amount of methane coming off of the Permian Basin oil and gas production facilities in Western Texas. And that's just leaking out. It's just simply leaking out into the air. It's not being used as a fuel source. So the methane is huge.
And then permafrost melting all over the world.
So there are ways to reduce emissions, reduce that leakage from oil and gas development. And when I was at EPA, we put out rules requiring that, and we're moving forward with that. And that's pretty much on hold under this current administration. But I think that's something that people will be looking at hard. The increased knowledge about the amount and impacts of methane from oil and gas development has really grown in the last 10 years when fracking started really opening up those fields. Well, there's lots of questions coming through and some compliments. Thank you very much. I think this has been an excellent webinar. It will be archived. That takes a couple of days, but feel free to share it with other people. I hope you will come to future webinars. So let me just let everybody get on to their next thing and practice good habits by ending roughly on time by thanking Dr. Steve J. and Dr. Gabe Filippelli and Andrea, of course, for making all this run. And thanks to all of you for coming. And please stay safe and well, and your families too.